Welcome back to Scanning the Mind, guys. Today we've got another one of our medical journeys series, and we're very lucky to have on Aiysha, who is an A&E trainee, also known as Dr. A.
I don't think anyone knows me as Dr. A, but...
No?
No.
You're Dr. A now.
Cool.
But yeah, thank you for coming on, Aiysha.
Thank you.
Appreciate it. After your busy schedule.
Mm-hmm.
Yeah?
I did actually just come off nights, so...
I woke up like this.
So you are an A&E trainee in second year. So let's start at medical school. Where did you go to medical school?
Medical school. So I went to two universities actually. I went to St Andrews, which is in Scotland, and I did my BSc there. And you do basically the theory side of medicine. And then you go to a partner university, and I went to Manchester University and did the 3 years of clinical. So all in all, it's a six-year course, but you get a BSc in St Andrews. So, interestingly, at first I was actually, when I was applying to medicine, I was torn between medicine and law. I know they're quite different, but...
It sounded like foreign person career though, isn't it?
Yeah.
Like, I imagine Arabs are very similar to Asians, like, what are you going to do? Engineer, doctor, lawyer? Yeah.
Basically, yeah.
Okay.
It was actually at school, there was this thing that was like a questionnaire for what career to do or what subject to study at uni or whatever, depending on your like hobbies or talents or whatever. And one came up with a neurosurgeon as like
right.
I know, right?
Every medical student's dream. What do you want to do? Neurosurgeon? Yeah.
Exactly, but this actually came up as like the career path or choice, and I was like, okay, I've never thought of that, but you know. A lot of my friends and family before I went to uni, like before I was leaving the country, leaving Saudi, they were like, so yeah, good luck in your career becoming a neurosurgeon. Everyone thought I was becoming a neurosurgeon. So I went to uni thinking, yeah, neurosurgery. Yeah, didn't really
pan out.
No. So in my training I did, I've kind of gone into my foundation training, by the way.
However you want to do it.
And I did pediatrics then, and did orthopedics, and I did GP and psych. Of all those specialties, the things that I liked the most was the acute side of all of it. So like the very like emergency, acute things, you fix the problem, done. Not any of the chronic, complex, there for years and years kind of thing.
Awaiting social.
Basically.
Yeah.
So I was beginning to think, okay, I like the acute side of things.
Yeah.
So I did a year out to kind of really think of, you know, what I want to do and what I want to specialise in. And I did a year of acute medicine. And I just found that I kind of liked that really quick turnaround.
Okay.
I never actually did A&E in my foundation training
did you not?
at all. No.
Oh, okay.
So I did it as a taster week in F2. So I did that for a week and I really enjoyed it. And I think also the A&E that I worked in was quite a good A&E, like the consultants, you know, they're very good support. And I really like the kind of team-based work.
Okay, yeah.
And anyway, so I spoke to obviously a lot of specialties because I also really like peds, but a lot of people like, yeah, really think about peds before you go into it. Obviously I was in it as a F2, so I did nights and on-calls and stuff. And I saw that it was very consultant-led, which means...
Peds, do you mean?
Peds,
yeah. Okay.
So the consultants were in like very late and having to come in even the next day, and I was like, oh, I don't know when I'm like 60 if that's what I really want to be, like coming in that late. And I did speak to a trainee and she was like, if I could go back, I would be a GP.
Oh, really?
Yeah.
Really?
And she was like ST 6 or 7.
Oh, wow.
Yeah. So I was like, oh, okay. But when I spoke to A&E people, and especially consultants, so they showed me their rota and it was amazing. And most of them are part-time. They had loads of like admin time between it. And they were like, honestly, you know, it's a great lifestyle.
Yeah.
The good thing about A&E is, I'm sure you've all done on calls, and I'm sure there's this little thing that you carry with you at all times.
Yes.
That makes you so nervous and hate your job.
That noise still gives me like shudders.
Exactly. So there's something called the bleep that we still use, and I don't know why, it's 21st century, but anyway.
I've already 3 at one time before.
Honestly,
different bleeps.
I worked at Preston, as medical on-call 5 while you're on the phone, and you're just like, I cannot cope.
Yeah.
And it just makes you want to cry. Even though they're probably not big problems, it's just the sound and you don't know what's behind that sound. Honestly, like, I just hated bleep so much, and A&E, you have no bleep.
Yeah.
So you can literally do your job without being disturbed constantly about stupid things that you could probably get back to later. Like, it's great. So So that's one thing. Another thing is I just really like the team-based work. I know, like, obviously all specialties there's, you know, team, but there's a constant team, and you're in one place, and there's all the team around you. Another thing is when you're especially like on medicine or whatever, when you're on call in general, you're dealing with a lot of sick patients, but they're everywhere in a big hospital, and you are one person and trying to be like in every ward with every sick patient, whereas they're all in one place in front of you, so you can literally like do something, go to the next one, go back and review, but very quickly. And I, again, obviously because I like the acute side of everything, and I loved peds, I really did enjoy orthopedics too. I liked surgery, I liked medicine, and I just liked all the acute stuff, and that's kind of what A&E is.
So you said that the consultant showed you their rotas and stuff, and their lifestyle seemed good.
Yeah.
So I think a big misconception then maybe is that A&E lifestyles are just horrendous, and it's just an awful way to live, and no one wants to become a consultant because it's so hard. So what?
Yeah, I think so.
Like?
To be honest, I think everyone in A&E, if you ask almost anyone as a junior that's done it, they've loved their time in A&E and their job. They just didn't like the rota. So that's like a really big thing that people hate. Is like the rota's very hard, and there's a lot of shift work. I actually really like shift work. I don't like a 9 to 5. I don't like a Monday to Friday. I love like 0 days. I love, you know, starting at 12 and finish. Like I kind of like that. I don't like a 9 to 5 fixed. That's just like my preference, but I do like shift work. So that for me, that wasn't an issue.
Fine.
And it gets so much better. Like once you become a reg, and even more, and then become a consultant. I personally wouldn't say so, because I do like the busy adrenaline constantly going kind of thing. I feel like when I'm in jobs where you sit down for a long time, I get lazier the more I sit down. Like if I've sat, you know, if I started my job and nothing's happened for a couple of hours, and then someone's like, oh, you've got something, I'm like, I have what? You want me to now get up? I've been sat here for 2 hours.
That's true, yeah, that's true.
Whereas if you start the job and you're just constantly running around, you just kind of have that momentum. But maybe people might not like that, or see that as a disadvantage, where, you know, you're constantly busy and constantly stressed. But personally, I don't think there are any.
Could you run people through like a typical day in A&E? I know there's no such thing as a typical day, especially in A&E.
So you come in, you look at the ambulances first as you're coming in.
Oh, I see, okay.
You assess the situation, how bad it is or how busy it's going to be. That is always
So when you're seeing 8 ambulances just kind of lined up, you know it's a bad night.
You know it's going to be a hard day. Start the day, they do a quick handover, so this is obviously starting an early morning shift. So they do a handover from the night team, so whoever's in the department still, you kind of obviously go through the patients. Hopefully by that time, actually in the morning, there's not a lot of patients in the department, but sometimes bed pressures, as we were saying, it can occur. Then you go onto the shop floor, they call it, and you start your day. So if the night team, if there were some people on the shop floor who were still had outstanding things or something, they might hand it over to you, like, can you chase the surgeons for this, or can you chase an x-ray or whatever, and then either discharge them or admit them or whatever it is. So if someone's handed over, that's probably your first job, is do that handover and get that patient, sorted. If nothing's been handed over to you, you go to, from my hospital, there was like a shelf, and you just take the first, first file, and you're not allowed to cherry pick. You don't look and go, no, I don't want to see that. You take the first one, and you just take it. Yeah. So you take the first, take the first folder, and then you start seeing the patient. So depending on how severe or where they are. So there's like a traffic light system, like green, amber, red. So if the folder's green, then they're probably in the waiting area and it's something minor. If it's amber, then they're like, probably danger zone, but not as bad as resus. And then resus obviously is completely separate. It's like a separate area, and you go and see the, critically unwell or, severely ill patients. And then that's it. You just literally kind of do that. The whole day. So you do, the first 2 years, you do 6 months of either A&E or acute medicine. So you do 6 months of those, whichever way around. And then the second year you do ICU and anaesthetics. So for the first 2 years, you do that for 6 months each. So you do 4 rotations, 6 months. So you get a really good you know,
Ideal.
exposure and,
Yeah.
and those specialties that actually, as foundation trainees, some hospitals like don't do ICU, anesthetics, no one does.
Yeah.
Because you don't get any exposure at
Yeah.
like medical school. Like,
Yeah, it's like that weak placement you get.
yeah. And so, so I was like, you know what? I'm not 100% decided that it's A&E, but this, you know, acute common care STEM looks like a good idea. So I'll just do that. But you have to choose a parent team, so you have to choose like a specialty. So either A&E,
Okay.
anesthetics, or
right.
acute med. So you have to kind of choose from the beginning.
Is that when you apply or once you've
Yeah,
got the
no,
job?
once you, like when you apply at the beginning,
right,
yeah. So I did apply for it as an A&E trainee because I was like, that's probably the most I'm familiar with. I definitely didn't want to do medicine. Acute medicine, as medicine I didn't want to do.
Fair.
I was not going to be a med reg. Not for me. I have so much respect for every med reg that's out there, but I could not do that job at all.
So many
Like,
people say that. They're like, I really
At all.
wanted to do the specialty,
Yeah.
but I just didn't want to be a med
I
reg.
could not be a med reg.
It is
like-
the worst job in the hospital.
So yeah, I was like, not going to do acute med. So I was definitely decided that. I didn't know anesthetics and I didn't know ICU or A&E, so I was like, oh, I'll just do it. So yes, and then I knew that I was going to do A&E as a foundation, as a ST1 for 6 months with this really crappy rota. So I was like, it's fine, 6 months, like I can deal with that, you know.
Yeah.
It's not the worst thing. It was probably the worst rota I've ever worked. It was like, it was so bad. 1 in 2 weekends. It was horrible.
Oh.
It was horrible. And you'd literally have these stretches of 7 days where you're working constantly, where they give you like half a day, like or in the middle. But
And
it's like,
yeah.
and it's straight, and it's 10-hour shifts.
And
so
it's A&E. It's not like it's going to be
and
quiet.
it's exactly.
Yeah.
There's no like, oh, it could be a quiet day, like sitting.
no.
Like you're not. You are literally like
Yeah.
continuously
Yeah.
working. Yes, you're allowed like half an hour break here and a half an hour break, but do you really get it? Honestly, by the end of 6 months, I honestly felt like I lived there more than, like I saw those walls more than my home, like 100%. But I was like, it's fine, it's 6 months, I can deal with it. And
Did
then,
you ever think in those 6 months, what am I doing? This is going to be my life for however long.
I still really did like the job as much as like I hated the rota. And honestly, the team that I worked with was great. Like, and a good thing about the hospital that I worked in was a lot of the consultants were females, so there were loads of role models, and it
Oh, that's
felt
good. Okay.
it felt really good. Like I was like, wow, like more than half the consultants were female. They're all like amazing like role models. So I actually kind of felt maybe this is a special, like I've chosen correctly here because I could see myself. You know when you see yourself in other people.
Mate, we picked up on this.
Yeah.
This role
Yeah.
model thing
Yeah.
is becoming quite a pattern.
Yeah,
Yeah.
every medical journey we've done so far,
Yeah.
everyone says that they're like, even if you know you want to do a certain specialty,
Yeah.
if you go and do one thing where you can see yourself being a
Yeah.
type of person, and you can look up to them, then you
Yeah.
end up doing that.
Yeah.
And I know where you work,
Yeah.
and I can see you being like some of the consultants.
You apply around, I think it's, I can't remember, this is a long time ago, but I think around October-ish
Okay.
time. And you apply through a system, like an online system. You choose the ACCS like training program. And then once you choose that, you obviously put your resume up and what your jobs have been, you know, the normal, you know, standard procedure of applying. Then you get called to an interview. This is obviously when I applied, so I don't know if things do change a lot.
COVID might have changed things. as well,
Exactly,
but-
yeah. So you do that first, and then you get called to an interview, and the interview was around January time. The interview, I think, had 4 stations from my memory. So we had a portfolio one, which obviously you talk about your portfolio and what you've done and stuff, and you get, you know, points and ticks for things that you've done. And then there was one that was basically a clinical scenario that they gave you like 5 minutes to read and then 5 minutes to talk about or like go through, which actually 5 minutes when you're nervous too, it was, time pressure was real. Then one was it was a presentation, so they give you a topic and you had 10 minutes to prepare and then 10 minutes to give the presentation. And the presentation was actually about why you chose A&E.
Okay.
So I literally just went through basically all this.
Yeah.
And
Could've taken this then.
I know, I could have. And then the last station was basically talking about the curriculum. So they wanted to know that you knew what you're getting yourself into and
Yeah.
you know, the exams and stuff. And that was it.
You mentioned exams, so what are the exams?
So again, they've changed the curriculum this year, but I'll kind of go by what, you know, broadly it is, and again, it might change by the time people apply. So there's initial primary exam, and that's a multiple choice question, or single best answer as they wanted to call it, but yeah, it's multiple choice. And then the intermediate is 2 exams. So again, they've literally just changed that. So I sat them as a short written answer, so short answer questions, so you know, just short written answers, and a situational judgment test. So that is really like a weird exam. But now they've changed it, and it's a short written, sorry, not instead of the short written one, it's an MCQ now, and instead of the situational judgment test, it's an OSCE, which is like a yeah, clinical.
It's quite a big change.
Very massive. But then the next one is after ST4. You obviously, before you become a consultant, it's you have to sit the final exam, which is a short written answers, multiple choice it is, and an OSCE.
Oh wow, you got loads of exams.
Yeah.
What, 6 in total?
5.
So finally, any tips or advice for budding A&E doctors out there?
If you're an adrenaline junkie, just do it. No question about it. If you like acute and variety, so you know, adults, children, if you love trauma, broken bones, and people coming in with limbs hanging off, go for it.
Well, Aiysha, thank you very much for coming on.
Thank you for having me.
Yeah.
It's been great.
Yeah, if you've got any comments or questions, pop them in the comment box down below. Otherwise, we'll see you guys next time.
Yeah, see you later.